Obesity is a clinical condition characterized by body mass index or BMI greater equal 30 kg per meter square. BMI is defined as the weight in kilogram. Is defined as weight in kilogram divided by height in meters square. Height in meter square. It gives a measures of relative weight adjusted for height. Classification of BMI. Classification of BMI. BMI 18.5 to 24.9 normal range, 25 to 29.99 overweight, greater equal 30 obese. 30 to 34.9 plus 1, 35 to 39.9 plus 2, and greater than 40 plus 3. Causes of obesity. Causes of obesity. Number 1, increased energy intake. Number 2, decreased energy expenditure. Number 3, endocrine factor. Number 4, drugs. Number 4, drugs. Now, increased energy intake. Causes of obesity includes increased energy intake, decreased energy expenditure, sedentary lifestyle. Endocrine factors such as hypothyroidism, Cushing syndrome, insulinoma. Drugs includes tricyclic antidepressant or TCA, corticosteroid, sulfonyl urease, sodium valproate, estrogen containing contraceptive pill and beta blockers. Tricyclic causes of obesity: increased energy intake, decreasing energy expenditure, sedentary lifestyle. Endocrine factors: hypothyroidism, Cushing syndrome, insulinoma. Drugs: tricyclic antidepressant, corticosteroid, sulfonyl urease, sodium valproate, estrogen containing OCP, and beta blockers. Management of obesity. Number 1, lifestyle modification or lifestyle advice. Number 2, weight loss diets. Number 3, drugs. Number 4, surgery. Number 5, treatment of the additional risk factor. Number 1, lifestyle advice: maximize physical activity. Maximize. Then changes in eating behavior. Such as food selection, portion size control, avoidance of snacking, regular meals to encourage satiety, and substitution of sugar with artificial sweeteners. Weight loss diet means low fat diet. Drugs include Orlistat. Orlistat inhibits pancreatic and gastric lipase. Inhibits pancreatic and gastric lipase. Pancreatic and gastric lipase, thereby decrease the hydrolysis of ingested. Thereby decreases the hydrolysis of ingested triglyceride, reducing dietary fat absorption. Reducing dietary fat absorption. Orlistat. Sibutramine. Sibutramine reduces food intake through beta-1 adrenoceptors and 5-HT2 receptor, 5-hydroxytryptamine serotonin receptor agonist activity in the central nervous system. Reduces food intake through beta-1 adrenoceptor and 5-HT2A, 2C, 5-hydroxytryptamine serotonin receptor agonist activity in the central nervous system. Liraglutide. Liraglutide, the most effective medications for obesity treatment are the glucagon-like peptide 1 receptor agonist. Other drugs, the combinations of low-dose phentermine and topiramate. The combinations of low-dose phentermine and topiramate. Surgery. 3 types of surgery: laparoscopic banding, then sleeve gastrectomy, and Roxen-Oy gastric bypass. Roxen-Oy gastric bypass. Treatment of the additional risk factors. Including smoking, excess alcohol consumption, diabetes mellitus, hyperlipidemia and hypertension. Management of obesity. Lifestyle advice: maximize the physical activity and changes in eating behavior such as food selection, portion size control, avoidance of snacking and regular meals to encourage satiety, and substitute of sugar with artificial sweeteners. Weight loss diets, low fat diet. Drugs: Orlistat, sibutramine, liraglutide. Others: Orlistat inhibits pancreatic and gastric lipase. And thereby decreases the hydrolysis of ingested triglyceride and reducing dietary fat absorption. Sibutramine reduces food intake through beta adrenoceptors and 5-HT2A, 2C, that means 5-hydroxytryptamine serotonin receptor agonist activity in the central nervous system. Liraglutide, the most effective medications for obesity treatment are the glucagon-like peptide 1 receptor agonist. Other drugs, the combination of low dose phentermine and topiramate. Surgery includes laparoscopic banding, sleeve gastrectomy, and Rox-en-Y gastric bypass. Treatment of additional risk factors including smoking, excess alcohol consumption, diabetes mellitus, then hyperlipidemia and hypertension. Complications of obesity. Now, complications of obesity. Complications of obesity. Number 1, cardiovascular complications. Number 2, endocrine complications. Number 3, respiratory complications. Number 4, musculoskeletal complications. Number 5, GIT and hepatobiliary complications. Number 5, neurological complications. Number 7, psychosocial complications. Number 8, renal complications. Number 1, cardiovascular, coronary artery disease, diseases of the coronary artery disease, hypertension, dyslipidemia and endothelial dysfunction. Endocrine cause includes insulin resistance, impaired fasting glucose or glucose intolerance, type 2 diabetes, precocious puberty, hormone dependent cancer such as breast cancer and uterus cancer. Polycystic ovarian syndrome. Polycystic ovarian syndrome causes infertility and hirsutism. Respiratory, exercise intolerance, obstructive sleep apnea, then asthma. Musculoskeletal causes includes osteoarthritis, ankle sprain, back pain. Then GIT and hepatobiliary, gallstone, gastroesophageal reflux disease, GERD, colon cancer, the non-alcoholic steatohepatitis, neurological pseudomotor cerebri, pseudomotor cerebri, pseudomotor cerebri. Psychosocial cause includes eating behavior, poor self-esteem, body image disorder, social isolation and depression. Eating behavior, poor self-esteem, body image disorder, social isolation and depression. Renal cause includes glomerulosclerosis and renal cancer. Glomerulosclerosis and renal cancer.